Hi, I'm Melinda Bridenstine, and I'm presenting information on a career in marriage and family therapy. The example organizations where a marriage and family therapist would work are private practices, hospitals, mental and substance abuse centers, government agencies, nursing homes, and elementary schools. Our career contact that I have is Dr. Drew Brazier of Optimal Solutions, Colorado. He has a PhD, and in addition to working as a counselor and therapist for families and individuals, he teaches classes at the university. He also does engagements as a keynote speaker, and he teaches classes in the community. So he does a lot of different things in his practice, and it is a private practice. The working environment for marriage and family therapists is that depends on whether they're in a private practice or in an agency. In an agency, the hours are going to be determined by the agency. And a private practice, you can set your own hours and determine your client workload. You usually have to work some evenings and weekends to accommodate your clients' schedules because of work and school. The typical stressors in this career are that you have to deal with difficult issues of abuse, infidelity, post-traumatic stress disorder, self-harm, depression, and grief. And these are really hard things to deal with, and that can really weigh on a counselor, especially if it's an issue involving traumatic experiences with children. And so the counselor needs to be able to separate their professional life from their home life and not take the problems of their clients home with them and not let that weigh on them. It can be challenging to not become frustrated or discouraged when you have clients who are not making the changes they need to make in their lives, and it doesn't seem like they're following the plan that you have laid out together with them. The therapist needs to understand that there are limits to how much they can do to influence an individual, and that it's the individual who needs to make those changes in their life. The counselor can just help to facilitate that and help them to set goals and give them techniques and skills that they need to be able to make those changes, and then the client has to be the one to do that. In suicidal clients, it's important to remember that if somebody is intent on committing suicide, that the counselor is not going to be able to stop them, because the counselor can't be with them 24/7 to make sure that they don't follow through on their intent. It's also important for the counselor the therapist to deal with their own issues in their own life so that they can help others and not have those problems weighing on them as they're trying to help others in their problems. You need to be careful not to take on too many clients as a therapist, because you'll quickly burn out if you have too many clients that you're working with. You need to schedule tasks in between. If you have difficult clients, you need to schedule tasks that are not involved with therapy and working with a client before and after those sessions, so that can more effectively deal with the stress from that situation that you're dealing with that client. The typical benefits in agencies, you'll have the benefits the other employees would have in that agency. Sometimes marriage and family therapists work part-time, and then they would not have any benefits, or they may work on contract, and in that case they would not have any benefits either. In private practices, the individual will have to provide their own medical and dental insurance, and also their own retirement plans. Common job tasks, I have a list here, so I'm just going to read this list. Collect information about clients through self-reporting inventories, interviews, observation, discussions, and formal assessments. Access, diagnose, and treat mental illnesses or psychological distress. Help clients overcome and manage disorders or illnesses with anxiety, low self-esteem, obsessive-compulsive disorder, depression, and substance abuse. Help clients deal with life-changing issues, including divorce, death of loved ones, or job loss. Help clients resolve interpersonal relationships, problems in their interpersonal relationships, and strengthen these relationships. Devise a plan of treatment for the client. Work with each client to develop goals for constructively dealing with problems and making changes in his or her life. Utilize various therapies to help individuals and families to constructively resolve problems and issues. Collaborate with family members and other health professionals and clergy who are working with the client. Refer clients to medical professionals and community resources. Develop post-treatment plans for after they leave your therapy. Maintain accurate case notes and records of evaluations. manage billing and insurance claims, and then also they would need to be able to market their services so that people will know that what skills they have and what conditions they treat. Marriage and family therapists, as far as education, they have to have a bachelor's degree and a master's degree. Some of them do go on to get a PhD, but it is not required. You need to be licensed by the state in which you're practicing, and in order to become licensed, you need to have your bachelor's and master's and then 2 years of postgraduate clinical experience working under a licensed marriage and family therapist, and then you have to pass a state exam. The salary for this career, if you're working for an agency, it ranges from about $30,000 to $50,000. In a private practice, you can make up to $150,000. Lecturing nationally as a keynote speaker, you get paid $5,000 per engagement. And some of the examples of the wages in the different agencies: state agencies, you'll earn about $62,000 a year. Local government, you'll earn about $57,000 a year, so that'd be like your community, in your local community. Hospitals and other medical settings, you'd earn about $55,000 a year. So in addition to the educational requirements, there's other skills that marriage and family therapists need to have. They need to have strong listening skills, organizational skills, problem-solving skills, and communication skills. They need to be compassionate and empathetic, and they need to be able to help the client to be able to trust them so that they can open up and disclose all of their thoughts and their feelings and their problems with them, because otherwise they can't really get to the root of the problem if the client is not willing to open up and talk to them. It is helpful that you're able to use different various technologies such as video conferencing, accounting software, spreadsheet software, and medical software, because a lot of the things you'll be doing on your own, taking care of all of that for your clients. Even if you're working with an agency, you'll have a lot of those type of things that you're doing. A career in marriage and family therapy can be very rewarding. You have the opportunity to work with individuals and families and be able to help them change their lives and help them to resolve issues that they're dealing with. And that can be very rewarding, seeing those challenges and those overcome those challenges, and seeing those families strengthen through the procedures and the techniques that you use with the families.